So oncoplastic breast surgery is the aesthetic way of doing cancer or for doing surgery for breast cancer. So the best way to describe it would be to think of the breast skin as the envelope and the breast tissue as filling. So when we take the cancer out, there is a cavity which is left in the breast, which fills with fluid initially. Now, if nothing's done to fill that cavity, then over time, the fluid will reabsorb and be replaced by scar tissue, which will contract, affect the skin as well, and cause a deformity on the breast. So we now have techniques where we can either reduce the envelope or bring tissue from somewhere else to fill the cavity so that we can prevent this deformity in the long term. So the cancer is removed safely and the breast aesthetics is preserved and sometimes even improved after cancer surgery. So I would say anyone having surgery for breast cancer will benefit from some kind of oncoplastic input. For smaller tumors, it will be about where to place the scar and how to redistribute the remaining breast tissue. More advanced oncoplastic techniques like therapeutic mammoplasty, where the breast is reshaped or reduced, or chest wall perforator flaps, where the tissue is brought from somewhere else, will be required for larger tumors. So it's about the relative size of the tumor to the size of the breast. It also depends on the location of the tumor sometimes. So for example, we know that tumors in the lower part of the breast are more likely to cause a deformity. So if the cancer is in more than one part of the breast, or if there are multiple cancers, then sometimes it may not be safe to preserve the breast. And in that case, we would recommend a mastectomy. Also, at times, if there are multiple medical problems and it's not safe to have a longer surgical procedure and anesthesia, then a simple wide local excision might be recommended. There's also a high risk of complications in patients with uncontrolled diabetes or smoking or anything which compromises wound healing. So oncoplastic surgery is a relatively safe procedure for the right patients. So besides the inherent risks of surgery like infection and bleeding, if we do a volume replacement technique, which means tissue is taken from somewhere else, then you might have an additional scar, for example, on the back. If therapeutic mammoplasty is used, where the breast is reshaped or reduced, then you might need surgery on the other side for symmetrization. So the main objective of oncoplastic breast surgery is to remove the breast cancer while preserving the existing shape and size of the breast. Sometimes even improving it, for example, when a breast reduction or a breast lift is used as part of cancer resection. For larger tumors, it can also help some patients to avoid a mastectomy.